everybody. Brianna here with another installment of our Insider Perspective Nursing Series. Nurse Deck is built on the collective nurse voice, and today we are excited to have Dr. Leonora Muhammad join us. Dr. Muhammad is a best-selling author, a speaker, and a correctional healthcare expert who also happens to be the president of the Black Nurses Association. So we have lots to talk about today. Dr. Muhammad, thank you for joining us.
Thank you. I'm super excited about being here with you today.
Awesome. Well, let's start right at the beginning. Tell us how you got into nursing and what led you into your current role.
Yes, I got into nursing, I would say, back in the early 1994 or so, 95. I was actually working as a candy striper here in the St. Louis area.
No kidding.
Our local hospitals. And my godmother at the time worked there, and she's like, "Hey, you can be a candy striper and you can have, something to do over the summertime." So I thought that was interesting. So I was able to go into the hospitals, and that is pretty much where I got the passion to work with patients and become a nurse because I was able to be right front and center with our nursing staff and see everything that they've done.
Mhm.
I know my mother, she had went to nursing school, but she didn't quite finish. So I had a little
Uh,
bit of experience of her being a CNA and then going into nursing school. But this was a little bit different because I was able to really see them firsthand and actually see what they do. And
yeah.
the biggest thing that I noticed was how the patient responded to the nurses. They were very thankful for the care that they was receiving in the hospital. And I
Yes.
just thought that, hey, I want somebody to look at me like that. And it just
Yeah.
gave me a positive light on the nursing staff and also CNAs and patient care techs that were working and everybody that worked in the hospital unit. It just really was like a family. So I
Hmm.
was, hey, I need to do this. So it was either between nursing and then teaching. So
Hmm.
I went into nursing, but as as I have evolved, into teaching roles too as well. So I got the best of both worlds.
Yeah, that's great. I love how you were able to pick up on kind of the team atmosphere that nursing plays a role in. And then also, I know exactly that feeling you're describing, that how the patients react to nurses in
Yeah.
particular, and how that can be such an attractive part of the job. It's nice to feel, needed and that you can help people. So I think that's a great aspect of nursing to highlight. So tell us, did you go for like the typical stepping stone of med surge and then branching out into different fields, or how did you land in your current role?
Yeah, so it's been a long journey. I think I took the stair step approach to my nursing career. So I pretty much did every step.
Yeah.
So I started out as an NA and then a CNA and then an LPN and then got my associate's degree, then bachelor's, and then my doctorate degree. So in
Yeah.
terms of the nursing career, I kind of took it slow, but I did every step to get me to where I needed to be. Um, After I graduated nursing school, I did a little bit of med surge, and then I went straight into geriatrics to work with my geriatric population. I love
Hmm.
the geriatric population. I love working in the skilled nursing facilities because I had a grandma and I had neighbors. They were all geriatric in age and that I cared for even at home. So I think
Yeah.
that's where I was a little bit more comfortable with working with those patients. So I did that for about 4 years until I was working one night, and one of the nurses that I was working with, she actually worked in corrections in the local jail in our city. So she was telling me all about that, and I was like, "Oh my God, I had never thought about nursing
Right.
a correctional center or a correctional
Yeah.
facility," and so it really piqued my interest, and so I said, hey, I'm going to try this out a little bit because I was looking for a full time job at the time. And so I went there and I've never left. And that was
Yeah.
10 years
Incredible.
ago in 2006. So I've
Wow.
been in correctional healthcare for about 15 years. It'll be 16 years this year. So I
Mhm.
found my passion with that patient population, and
Mhm.
that's kind of how I arrived in corrections.
Yeah, very interesting. Not a lot of nurses, I think, are familiar with that. Like you said, you were surprised yourself,
Yeah.
to learn about that role. We had another corrections nurse on here a couple weeks ago or so, and she
Mhm.
had some interesting stories about how she ended up in that role as well.
Yeah, and
But
that's really how it is in corrections. Most people don't say, "Hey, I'm gonna graduate nursing school or medical school, and I'm gonna go into corrections." We kind of stumble upon it,
mm,
what we do every single day. Or like if you're working in a hospital, you may have patients that come in from the local jails or prisons that need to be treated. So
right.
that's kind of how most of us get introduced to it, or we've
Mhm.
done a clinical rotation or some type of externship in corrections, which is, we associated with community health too as well, which are
Right.
of a lot of nursing programs and also medical programs, and also behavioral health programs as too. They want you to be in the community and really serving those patients and
Yeah.
serving that patient population. So that's kind of
Yeah.
how we stumble upon corrections. But once you get in there, you either love it or you hate it. So those of
Right.
us who have stayed in there, we love it, and that's why we do it,
Yeah.
because that patient population really needs the help, and
Absolutely.
yeah, they really need the help.
Yeah. What would you say is one of the most challenging aspects of correctional nursing, either that you face yourself or that you think, on a larger scale, that corrections nurses are facing today?
Yeah, correctional nursing can be a challenge because of the different environment that you're in. But the nursing care, the medical care, is all going to be the same because we're treating patients, right? Uh,
Mhm.
so the level of care and what we do for the patient is the same whether you're inside a correctional facility or you're outside a correctional facility. But the challenge that we face is just the environment that we're in, making sure that we get the resources that we need, also being able to move accordingly to make sure that the patient get what they need. But we have a huge partnership with our custody partners that really we work as a team to make sure that from the security side and the medical side that the patient gets what they need. But
Yeah.
um, that can be somewhat of a challenge. But we definitely have policies and procedures that we work, and as long as we meeting the same goals and we going towards the same goal, which is basically making sure the patient gets what they need,
Yeah.
then it's pretty much the same as any other
Right.
place that you will work and serve and provide nursing care. So,
Exactly. That's a good point. As your role as a chief executive nurse, can you tell me a little bit about the advocacy part of that role in terms of, I mean, I know the patient population that you work with, a lot of those types of patients can fall through the cracks, of many aspects of society, not just healthcare, and how you advocate for your patient population.
oh yeah, absolutely. Because the patients, like I said, they have a lot of care that is needed. When they
Yeah.
come to our correctional facilities, they may not have access medical care in the community. So it's first about setting a baseline and understanding what the
Yeah.
patient's needs are, because it can be challenging. They have a whole list of chronic care illnesses that they may be suffering from, behavioral health issues that they may have to need to have addressed,
Yeah.
and also substance abuse issues. So they are very complex patients. So
Mhm.
we advocate for first identifying, what their needs are, and making sure that we get them enrolled in a chronic care clinic or
Yeah.
behavioral health services that they need to get them stabilized.
Yeah.
And that's the biggest thing that we want to advocate for, is the stabilization of the patient first, so that they
Mhm.
can be able to return once they are released from our correctional facilities, return to the community stable, on their
Mhm.
medications, having got all of their chronic care illnesses addressed, so that they can return back into the community. So reentry is really important for us. And so we really
Mhm.
advocate for the patients to have a smooth transition back in the community. So when they
Right.
leave our facilities, hey, they've already got a doctor's appointment set up. They've
Yeah.
already got an appointment to see the psychiatrist if that's the need. They already have transportation, a place to live.
Right.
Um, all of these key things that they need that, most people just don't think about. But if you don't have a place to stay, then,
Right.
that's gonna cause a problem. So you
Sure.
might get into bad habits of trying to figure out, okay, well, I may have to do this in order to provide for my family or provide for myself. So it's
Yeah.
really, we really try to advocate in my role as a chief nursing executive to advocate for those community partnerships and connections with the community so that they can receive our patients and it's a seamless transition back into community because most of the folks will get released. Only a
Yeah.
small percentage of them will stay incarcerated, but a lot of them will be released from the county jails and city jails. So we want to
Right.
make sure that they return stabilized and also have the opportunity to partner with community organizations that can receive them
Yeah.
in the community. So
Absolutely. Yeah. It's a lot of a big social work aspect to what you guys do for sure. It sounds like.
yeah,
Yeah.
and public health, concern because with
Right.
COVID going on, we want to make sure that they have been tested, they have been treated.
Right.
We partner with our local health departments to make sure that they have the key information they may need. So from a public health perspective, that's also something that we advocate for too. And we stay
Right.
in close communications with public health departments from city to city in which we hold contracts. So again, the community partnership is key for this
Yes.
situation.
I bet. Yeah, absolutely. Walk us through your approach in leading healthcare organizations through change.
Oh yes, change, change, change. The dreaded change. Everybody, may not like change, but it's
No.
absolutely needed. And we seen that real quickly when COVID popped up.
Yes.
We had to change a lot of different things. So, definitely how I approach the change management is pretty much through a process. Um, we got to make sure that people are aware that things are going on and let
Mhm.
them know that, hey, this is what the issue is. Give them knowledge to let them know that, hey, this is the situation that we're going through and this is why a change is needed. So I kind of walk them through a change management process that I use,
Mhm.
which is APRN. And it's really just getting them from understanding what the issue is, buying into the issue, and understanding
Mhm.
they need that, but we also give them the tools that they need to be successful with the change because we can't say, oh, it's a change going to happen, but then we don't give the site and
Right.
staff the
Yeah.
resources that they needed. When we seen COVID pop up, hey, you guys need proper PPE, right? You got to have
Mhm.
gloves, you got to have gowns, you have to have masks, so in order for
Right.
you to take care of the patient, we as executive leadership and organizations, we have to provide you with the needs and the
Right.
tools that you need to be successful. So if you walk through just the initial awareness of it, knowledge, the desire to want to change, giving them the tools and reinforcing things over time, then
Mhm.
people are better suit to embrace the change and then be a
Right.
willing participant in the change.
Right.
We got to
Right.
see why they doing it and why it's needed, and get them to have a desire of how would this affect patient care?
Yeah.
How by making this change is this gonna affect patient care? And if you do that, then I think the change is much, much easier.
Yeah. Yeah, I agree that the buy-in part of it is so key for it because otherwise you're just fighting against people's natural urge to keep things as status quo, which, you
Exactly.
know,
Everybody want to keep things the same. I've been doing this for 20 years this way.
exactly.
It's like, no,
Right.
let's be a little bit more innovative and,
Yep.
seeing what else will work, Not that it's a bad idea, but maybe it's you can think it and reimagine your process a
Yeah,
little bit more. So, yeah.
absolutely. Talk to us a little bit about current working conditions for nurses, um, particularly with regard to burnout and short staffing. I mean, these are things that I think would pop up for any nurse in their career before the pandemic. But
Yeah.
since the pandemic, a lot of nurses just idle there in a state of burnout and exhaustion.
Yeah.
What do you feel about that? What are your thoughts on that?
Yeah, right now, of course, staffing is a big concern all across the country. Staffing is a big concern. And it has been even before we entered into a pandemic. It was the number of nurses that we got entering into the field, a number of nurses that we have returned from
Yeah.
the field. So it has always, for over the last 20 years, have been an issue and a concern with getting more nurses interested in nursing and to stay in nursing. So I think what we have to do right now is to embrace our nurses and to make sure that they're taking care of themselves.
Hmm.
Burnout is real. And if we are not advocating for self care with the nursing staff, then you're going
Hmm.
to have a problem. So, organizations and executive leaders, they have to really think about how can we address the self care issues of our staff and,
Right.
reimagine how the work life balance works, right?
Yep.
So we traditionally used to 12-hour shifts or 8-hour shifts. Maybe we need to rethink that. Maybe we go to a 4-day work week with less hours. And
Yep.
you carve in time within your work day to say, hey, we're going to take a 30 minutes self-care wellness break,
Yeah.
and add that to a 30-minute lunch break, right? Or, we just
Hmm.
have to reimagine how we look at nursing and what ways can we help our nurses to really focus on themselves. Because if you're not focused on your self-care, you're not
Hmm.
exercising, you're not doing things, you're not taking your PTO time off,
Right.
how good are you going to be when you show up to work? You're going to be drained,
Right.
you're going to be, fatigued, so we have to take care of ourselves first, right?
Yeah.
We take care of everything else. We go to the doctor to get our healthcare needs addressed, but we don't address that mental health and the
Right.
mental well-being of ourselves.
Yeah.
We have to focus on that. So I think that's what we have to do as organizations. We really have to get our nurses really in tune with mental well-being and
Right.
self-care, and then everything else is going to fall in line, right?
Yeah.
The staff and people going to want to come to work. People going to want to, stay within nursing. They don't want to exit. If you're a
Yeah.
seasoned nurse that's near retirement, you're going to say, oh, okay, well, maybe I can do this 5 more years, or maybe I can do this
Right.
4 years, so I think it's going to help on the front end and the back end. Um,
Yeah.
the other part of it is, getting people interested in nursing. So,
Right.
to even know that healthcare, is a great place to be. Nursing is a great career. There
Hmm.
are many different avenues. One thing that folks that may not be in the nursing yet, they only think, oh, it's just bedside care. Nurses
Right.
are doing every single thing that you can imagine,
Right.
from, the typical bedside care, but also leading
Yeah.
teams and in leadership,
Yep.
working in case management review, telephonic nursing,
Yep.
um, help. I mean, it's all kind of different avenues.
Yeah.
Teaching, nurse, what you call it, legal nurse consulting.
Yep.
It's all kind of things that nurses can do. So I think letting people know that those are options,
Hmm.
early on. I'm talking elementary school before they even get to high school to really determine where they want to go with their career.
Right.
We're pitting them, in elementary school. So I think that's what we need to do to create awareness of the nursing career and getting those little ones thinking about nursing very early so that they can
Hmm.
make decisions once they get to high school. And then we already have prepared them. So we got to
Right.
create a steady pipeline of nurses
Yep.
to want to come into the career.
Yeah. I love what you were saying about how it does fall on the organization to shoulder some of the responsibility for nurses' self-care instead of just saying like, this is something you all should be doing,
Yeah.
and don't quit without trying this stuff first, to actually being a proactive partner with the nurses. Like I loved how you were talking about, beyond your 30-minute lunch break, there's other things that we can support you in.
Yeah.
I've heard of some hospitals leading like meditation classes and different things like that. So they feel like they're partnered up with their nurses as opposed to just like adding one more thing to their plate that they're supposed to have a magical amount of time that they can allocate to it, which never seems to happen, shockingly. Um,
Yeah.
when you've got about identifying your own burnout, how do you think that you're able to either prevent it, which is key, or handle it if you feel like you're right in the thick of it?
Yeah, whenever I feel like I'm getting stressed or getting burnout, I really carve in that time throughout the week. I know just on my day to day, that calendar fills up fast.
Yeah. Right.
People have the ability to put meetings on your calendar and things just pop up. But I've started carving in time in my calendar to say, hey,
Yeah.
this is what I need to focus on between this hour and this hour. And within those hours, it's a little bit of self care. And
Yeah.
that's
Right.
whether it's just, taking a little time to, have a coffee break or taking a little time to say, hey, I'm going to read this article that I've been sitting on for the past 2 weeks
Right.
that I haven't got a chance to read,
Hmm.
and carving that 30 minutes into my calendar so that I can focus on things that are important, that also will help me, in my day-to-day operations, but also help me personally. So
Hmm.
I think that's my one approach to how I handle the stress and the burnout, and just hanging out with your friends, and just
Yeah.
other nurses, and understanding what other nurses are doing,
Hmm.
because we seem to kind of always want to just take care of ourselves, but you got to talk to your friends and talk to colleagues, and
Yeah.
have that time where you can connect with other people, and it's not just you in
Yeah.
front of the computer screen. We got to get out there, and we got to start socializing again,
Yeah.
because we've all just been in front of this computer screen for the last 2 years. So
Yeah. Exactly. I think you're so right about that. And I think there's such a element of healing just being around people that have gone through something similar to you where you don't need to explain all the backstory of it. You just get it, you know.
yeah,
Just being in those spaces it's incredibly healing. I love that you highlighted that. I know you do a lot of speaking engagements as a motivational speaker. What would you say is your best advice for nurses or nursing leaders in particular, to keep them going, to keep making good contributions to the nursing world?
yeah. My biggest thing that I love to do is do my commencement speeches in front of those students,
Yeah.
because the students that are coming out, they are scared.
Yeah.
They're scared. They're scared for a multitude of reasons. Scared to
Yeah.
don't pass their NCLEX test. That's the first thing. And then secondly, just how will they make it in this new age world of, pandemics and short staffing and all of this
Yeah.
stuff. And then even having all the knowledge that you believe that you need to have,
Right.
when you got a nursing school, you're not going to know everything overnight. And the schooling part, it was just the beginning. The experience is where you learn majority
Right.
of what you need to know. So, that's the biggest thing that I love to do, is to talk to those students and encourage them, that they can do it. If you see everybody else around you in this room have done it, then you absolutely can do it.
Right.
And, my biggest advice is to get a mentor and get it early,
Hmm.
because
Yes.
that was one thing that I did not tap into when I was in nursing school. I thought I can just, oh, I can do it. I can study on my own.
Yes.
I was just navigating through the maze, by myself.
Hmm.
So I really recommend that students, even seasoned nurses, get you a mentor, find you a
Hmm.
mentor, because that is so important. We
So
spend
important.
so much time trying to figure things out when somebody's already went through the path, and
Right.
already got the answers. So being able to bounce things off of a preceptor or a mentor, is something that I really would recommend. And that's my
Yeah.
biggest advice to anybody that I meet, young or old, that you need to have a mentor, somebody that you can call, bounce things off of,
Hmm.
navigate through your nursing career, identify new things that you can do to advance you in your career, because professional development is very important to me.
Hmm.
So
Right.
people should continue to learn every single day, and don't get stuck and stagnant in something. If and that's
Right.
another reason for burnout. You just keep doing the same thing over and over again, and you're not looking at other opportunities for other
Right.
things that might make you happy in your career. So professional development is very big. So that's my biggest advice: get you a mentor and get them early,
Yeah.
in order to help navigate through your career.
Yeah. I think there's a a thing that we experience now where there's just so much information available to us at all times. I mean, you can Google your way out of anything, it seems like, but
Yeah,
there's really no substitute for that mentor-mentee relationship. And
no,
that's not something you can look up on the internet or find in a chat room or anything like that.
exactly.
Um,
Real life experience that those
right.
mentors have, people that has been doing it for a long time. So I still
Yeah.
call, I got, and you don't need to just have one. I have many.
Right.
I have a few, and
Yeah.
everybody brings a uniqueness to what I need. You know, somebody that's been in healthcare management, or somebody that's really
Yeah.
good at patient care, or somebody that's really good on the business financial side. You know,
Right.
so it's you can have more than one mentor. So
Right.
find those people that are passionate and want to help, and that will push you to be a better you.
Right. Yeah. It's key. I agree completely. Um, what are some things you would like to see in terms of changes in healthcare following the pandemic? I mean, we had so many, we were talking about change earlier. We had so many changes come through that we were sort of building the plane as it was flying. Um, but a lot of innovations have come out of that for nursing led innovations. What
Mhm.
are some of the changes that you would love to see happen?
Yeah, and some of the changes have already happened. Definitely increases in pay, and for our
Yeah.
nurses, nurses work very, very hard, and they are in all kind of different specialties within nursing. So, making sure that they get paid appropriately to the work that they do. Um,
Yeah.
you know, pay nurses that have high acuity rates at some of these facilities, they need to be compensated for that, because that's a lot of work, and it's a lot
Yeah.
of stress and focus that they need to make sure that each patient is getting the attention that they need. So I'm happy to say that it has been happening in our communities and around the country. So I'm very excited about that.
Hmm.
Additional thing that I would want to see is more authority for our nurse practitioners. That's always still a push, and as
Right.
we've seen, and throughout the pandemic, nurse practitioners can be very beneficial to organizations. So we
Hmm.
have to keep pushing for the legislative
Yep.
legislation for nurse practitioners to have full authority in these states. You know, we are seeing patients. We provide very good patient care to
Right.
our patients, and we should be able to practice accordingly. You know, so
Yep.
definitely advocating for more of that. And again, when we talk about the self care, make sure you're infusing that into our policies within our
Yes.
organizations. You got to carve out some kind of piece of that inside of what we do every single day. It's not just a
Right.
typical show up to work and here's your salary. There you go. You know, we
Right.
have to be creative on the HR side for carving that into our budgets for our nursing staff. So those are kind of some of the key things that I want to push for. Full
Yeah.
authority for the nurse practitioners and people just working to the scope of their practice, you know, high scope of their nursing practice. So those are
Yeah.
something important.
Yeah. Love that. Talk to us a little bit about the importance of community. I mean, at Nurse Deck, we are a nurse-led community, and we're huge on getting people into the same spaces to collaborate. I know you are the president of the Black Nurses Association. That's an amazing community to belong to further professional development and network. Can you talk a little bit about what a good support communities are for nurses today?
Yeah, the Black Nurses Association of Greater St. Louis, we love getting out in the community. So, and that's another thing that's important for you as a nurse in your nursing career is it's not just you showing up to work every day, but how are you affecting the community in which you live? Because
Yeah.
again, whether you're in a hospital, in a correctional facility, a nursing home, may come back into the community. So
Yeah.
everything needs to be a focus. So, you know that is one of the reasons why I'm part of the BNA, and I'm also on the board of directors of the National Black Nurses Association. So
Okay.
we love to get out in the community because when we get out there, we see that it's a lot of education that's needed with our patients.
Yeah.
Patients know where resources to go, you know, where to get things done, how to connect with their providers, what questions to
Mhm.
ask their providers, you know, and
Yeah.
even just as simple as, oh, I've been having a headache, to say, hey, maybe we need to check your blood pressure. So
Right.
we have to get out in the community And the community needs to see that nurses are not just in facilities, but we also live next door to you, right? We're your
Yeah,
neighbors,
right.
you know. So,
Yes,
because our world is different from it was 20, 30 years ago, where everybody knew your neighbor, but now you don't
right.
know anybody. So we
Yeah,
as
so true.
nurses, we got to get out in the community so people can see that nurses are doing stuff inside of facilities, but also outside in the community. So
Yeah.
that's something that we do within our organization. We go out, we do health fairs, and we educate people about their healthcare conditions. We do blood pressure checks and screenings.
Mhm.
Try to be a liaison from the patient to
Yeah.
community resources that they can tap into to get
Mhm.
if people having problems getting meals. Connecting them with shelters or
Right.
organizations that provide like Meals on Wheels and stuff like that. We have been working with doing COVID vaccines and helping people
Mhm.
to distribute the COVID vaccines, and then also do testing in the community. So it's a lot of different things.
Yeah.
Delivering food to homeless and working with the homeless shelters and doing toy drives, for um,
Mhm.
those people that are in need around Christmas time and holiday time.
Right.
So, yeah, community, is really big, and is really big within the Black Nurses Association on a national level. That's what we do every
Yeah.
single day. But the education piece is a huge piece. So we have
Right.
annual conferences that nurses and all nurses can come to learn more education about, different disease processes, and working with those pharmaceutical vendors to kind of
Mhm.
understand the medications that we give in, and knowing what the, current new latest guidelines are. So yeah, community
Yeah.
is really big, and so that's a reason why I'm part of the association and president of the APRN.
Yeah. I think it's also great too for nurses that are maybe feeling burnt out to feel, I mean, any nurse that I know, you don't say I work as a nurse. Everyone says I am a nurse, and
Exactly.
usually within your family, you are like that go-to person for every 3 a.m. text
Right.
message question. Yeah. Like I have a friend that you're like, uh-huh.
Yeah, we're gonna
But
say, so can you gonna so can me for this advice? No, but we know what
yeah.
we do. So, we even when people don't ask us for our advice, we giving it anyway.
Yeah.
We something
Right.
out of ordinary.
Yep. But I think it's a great way to reconnect kind of with your roots of nursing if nurses haven't experienced that because we have such a bigger reach than what we do when we clock in and out of work, whether it's with our families or church communities or any sort of grassroots local based outreach. It really can help people feel more connected and purposeful in their work.
Yeah.
And organizations like the Black Nurses Association is one way to get your foot in the door if you're not sure where you might be able to best serve people. So
Absolutely. And what one thing
encourage.
that we say DNA is in our DNA, because it's really who we are. It's
Yeah.
not just putting on a suit to say, hey, we the DNA. But no, this is
Right.
really our passion
Yeah.
for providing patient care and making sure that everybody has what they need. That's all,
Yeah.
that's really the goal of anybody, any person in this world, is just to have
Yep.
the basics of what we need and be taken care of and loved by our family and take care of our children. We all have
Yeah.
the same goals.
Right.
And so it's really within us. We also help with scholarships as well, for our nursing
Yeah.
students. Again, it's about giving people what they need, and being there when they need you. So,
Right. Love that. That's great. Well, we always like to wrap these interviews up by giving you the floor if you have any messages for nurses that are out there. We have a lot of nursing students, nurses that are just entering the field. I mean, all the way through all levels of nursing, really, but particularly a lot of baby nurses. So we always love to get different, perspectives and advice from our interviewees on nurses today.
mhm. The biggest thing I would say, if it doesn't challenge you, it doesn't change you. So
Ah, love
just
that.
to tap into it. Nurses that are in nursing school, nursing students, it's like, oh, this is so hard. But how many nurses do we have in this country? Everybody that is a nurse has done it.
Yeah.
So you can do
Right.
it too. So things may be hard, it may be challenging, but if it's not challenging, it's not going to change you. So
Mhm.
just embrace the change. Be out there again. Get your mentor, and then some for some of our seasoned nurses. Just find that spark again. Think
Mhm.
about why you got into nursing to begin with, and
Right.
if you take yourself back there, then I think you're gonna have a renewed purpose of why you
Yeah.
should continue to stay in nursing, why you did it, and be able to, even if you're on retirement age and you're going out and you're on the way out, but you're gonna bring a couple in as you go out.
Mhm.
So,
Yep.
just keep going on, and we're gonna be good. And
Yep.
we come out of this pandemic thing, and we got nothing to look forward to but the future. So
Right.
that'd be
Love
my
that. If it doesn't challenge you, it doesn't change you. I think that's such a good reframing of a feeling that we all know all too well. So, I love that. Well, thank you so much for your time. We love